We want to welcome right now Brian Todd to the program, who's with Metro Nashville Department of Health. And when we have Mr. Todd in this seat, we want to talk about a couple different topics. It's so great to see you and visit with you. And I'm glad that we have you being able to talk about a couple things. First of those, mosquitoes, because a lot of people are spending time outdoors in the nice, summer heat. And we're all doing this number, and some people want to spray, and some people are lighting candles, but mosquitoes are out there, folks. And you all are doing a great job year after year, Brian, you always do, in terms of trying to combat West Nile. Talk a little bit about what the department is doing this year.
Well, every year we learn something from the previous year, but one of the things we want to make sure people know is what steps they can take to, one, reduce mosquito breeding grounds, and two, to protect themselves from biting mosquitoes. And of course, we do offer a Fight the Bite brochure. We do community events. We have this on our website. Those are all things that we want to make sure people are getting the message.
Absolutely. And it explains, almost has a rundown of things to be thinking about, because when we're outside, we're not necessarily, and it's warm, we're not wanting to wear the longer sleeves or the jacket, but you have to protect yourself and your skin and little areas to where those little critters can get. What are some of the things that people really should be thinking about in the evenings? And that's obviously when the mosquitoes are out there.
That's right. The types of mosquitoes that are known to carry West Nile are dusk and nighttime biters. Okay. And so you want to make sure that you're protecting yourself if you have to be outdoors. That means wearing a repellent, and by all means use it based on the directions. A lot of people may overuse it, they may spray it in their eyes. We don't want them doing that. But a good repellent, of course, wear an extra layer of clothing. That as an added layer of protection against you and the mosquito. And also, people who have screens that leave their windows open at night, make sure that the screens are in good shape. If there's a hole in the screen, there's more likely that you're going to have mosquitoes inside the house, and we don't want that either.
Sure. You all, years ago, used to go through the neighborhoods with your trucks and spray. You don't do that anymore. Explain what you all do nowadays to keep everybody safe.
Well, throughout mosquito season, we will be out in the areas, and we have a good history now of locations where we've had problems in the past. And so we start visiting those areas, usually in early March, go through mosquito season, which ends in about October. We're looking for standing water. If we find the mosquito larvae present in the standing water, then we'll apply a granular larvicide. What that does is it kills the mosquito larvae before they become biting mosquitoes. So we really focus a lot in that way throughout mosquito season. Then we also, like I said, we like to get out into the neighborhoods. If you have a complaint about mosquitoes, we'll come, we'll look at your property and give you some ideas of what you can do to reduce mosquito breeding grounds.
All right, early in the season, you all have already detected some mosquitoes that are carrying West Nile. Doesn't mean that every community is going to have that same issue, but you really do then focus right away. And you had mentioned earlier, before the program started, going door to door and informing folks about this, correct?
That's exactly right. Part of what we do is we test, and we do that by trapping mosquitoes. We send those to the state lab. If we find West Nile in the mosquito population, then we will actually go into that neighborhood. We will go door to door. We'll pass out the Fight the Bite flyers. We'll let them know what we're finding and what steps they need to do to protect themselves from mosquitoes.
Sure. Something that a lot of folks always think about, what do I have in my backyard that's collecting water? You all do a great job also of letting people know, take that planter and get the water out of it, or buckets or things like that that you have in the backyard. Even kids' toys, things that could collect it. But you brought something to show folks, and tell us what it is and about it.
So a bottle pop top. CDC a few years ago did a study outside of Atlanta. They put water in a bottle top pop. They left it for 3 days. They then brought it in, looked under a microscope, and there were over 3,000 mosquito eggs in something as small as this amount of water. So that's something that we always remind people, it doesn't take much water, whether it's in a clogged gutter, a bird bath, or something as small as the plate that you have under your flower pot. Doesn't take much water for mosquitoes to lay eggs and for larvae to hatch out, and then you've got a mosquito problem.
Yeah. So even when the season, we're out of the wet, rainy season, you still have to be aware of those kind of things in the backyard.
That's exactly right. Many times in August and September, it will be in a dry season, and people will call our folks and say, I've got a really bad problem with mosquitoes. What am I doing? And so we'll go out, we'll have a check of their yard, and many times it's something that's right there on the patio in a small amount of water.
All right, and we need to point out that the pesky critters finally go away first frost, usually.
First killing frost, and that's the end of the season.
Okay, Brian, let's go ahead and change up to the other topic that we need to discuss today, and that's going back to school for the kiddos, having those immunizations. Talk a little bit about the importance of that.
Well, immunizations are probably one of the biggest, most successful public health campaigns that we've ever had. You think about measles, mumps, rubella, chicken pox, whooping cough. All of those are very rare now, and the reason is we're able to prevent them with vaccines. And so we want to make sure that kids that are going back to school are properly protected, and the easiest way to do that, make sure your shots are up to date.
You all have held clinics for years in several locations. Will you continue to do the same thing?
Absolutely. You know, the week before school starts, we will set up a fast-track clinic, and that's all we're doing is offering the shots specific for kids to go back to school. Those are the requirements that the state has for kids to go to school in Tennessee.
And that's, we should point out to parents too, that's for kids entering kindergarten, and then also, is it 11 years of age? I don't know if that's more middle school.
Right.
So there's certain times in their life that they've got to go in for these shots.
What we've learned over the years is some of these immunizations weaken as a child gets a little bit older. So for instance, the measles, mumps, and rubella, the varicella, they need a booster, and usually that happens in middle school.
All right. How can parents get information on where locations are and that type of thing?
Of course, they can visit our website, health.nashville.gov, and that has all 3 of our clinics. One of the things that we feel like is very important is if you have a pediatrician, take your children to the pediatrician, because there they get a well-child exam.
That's true, sure.
And so it's looking more beyond just the child's immunizations, but maybe they have a problem with asthma, or maybe they have a problem with other health issues that they need to address with a pediatrician. But we do offer them. We offer them at all 3 of our health centers, and they're offered Monday through Friday, 8 a.m. to 4:30 p.m.
And is there anybody, Brian, any children who are not allowed to get the immunizations through the clinic? The reason why I ask if they have some other health complication or anything like that you all have to question parents about as part of the process.
We do, but typically it's something that that a parent or a physician would say, you know, we need to make sure that we're not getting that one. But what we do is we want to make sure that they're available and provide those throughout the community.
And obviously they have to block out a little bit of time. It doesn't take all day, but...
Yeah, that's a very good point, because these are not scheduled appointments. All 3 of our clinics are walk-in clinics.
Right.
And if you're coming, you know, throughout the summer, many times we're not as busy as we are the week before school starts, or even the week after school starts, when kids have been told you can't come to school till you have your shot record updated.
And obviously you all still work with parents even after the start of the school year, because people are still transferring in and that kind of thing.
Right. Yeah, we offer immunizations throughout the year. Okay. But our busier time is definitely when school is about to start.
All right. Brian Todd with Metro Nashville Department of Health, we so appreciate your time today. And thanks for all of that information. We really appreciate it.